Dee, how are you doing?
I'm good. How are you doing
I'm
today?
doing all right today.
Good.
So last week we worked on the arm, the elbow area.
Mm-hmm.
I understand we were going to kind of venture into side lying
Correct.
areas.
Mm-hmm.
Um, is there anything else that you have been feeling over the last week?
Nothing new.
Anywhere
My
else?
knee still bugs me, but it's less than when I first came.
It is.
But that still bugs me. That's really it. So
Yeah. It's not a debilitating type of
no, I
pain
mean I'm
though.
able to run
You're
and
still
yeah.
running.
Mm-hmm.
Does it hurt like while you're running or is it more
No, it
so
doesn't hurt while
after?
I'm running, which is probably why it's a good thing.
Yeah.
I would
Yeah,
probably
yeah.
do it anyway, but it's usually after I've been standing for a long time or sitting for a long time with my leg bent. It's kind of the same.
Yeah. Is it like an achy pain?
It
Dull and
is. It's like an
achy?
achy pain or like a hard time like releasing it out. It pops. It's consistent with like runner's knee
I
or
got you.
yeah.
Have you ever had an MRI or any
Mm-mm, no.
it
Mm-mm,
checked out? Okay.
no.
All
No,
right.
it just started. I haven't had problems before. I had a
Okay.
similar problem this knee and it dissipated. Now I don't have any issues.
I got you. Do you want to maybe change our focus to that knee area again? Maybe get some stuff opened up because I
Sure.
know you like to run. You run what, a few times a week?
Four. Yeah, four
Four
times a week.
times a week.
Yeah.
Do you want to spend some time there again then rather
We
than
can.
the
I'm
upper
fine with
body?
that.
Okay.
Yeah.
All right, let's do that then. Both the back and the front part of your feet just staying on the floor and just bringing your knees forward right above your feet. That's perfect.
Okay.
And let's bring those arms
Mm-hmm.
up a little more.
Oh, up.
Yeah, that's
Gotcha.
perfect. And just come back up nice and slow. Let's do that one more time. Good. That heel's not wanting to come up. The knees aren't shaking. That feels okay.
Mm-hmm.
All right.
Mm-hmm.
You want to dig in some?
Sure.
Yeah, let's do it. We worked that front shin muscle last time.
Correct.
I say let's start from glutes and work our way down
Okay.
then this time.
Okay.
We'll connect with where we stopped that treatment 2 weeks ago. So we'll start face down then, Dee. So we're gonna start in the glute area. Um, we'll try to we're gonna push on some little trigger points that are sitting in that glute deep and latent. They're probably limiting some hip movement and it trickles down into the knee, vice versa with here. You
Mm-hmm.
know, if there's something going on structurally and muscles that are tight in one area of the body, it's going to affect the next area, then the next area, and so forth. So with the glutes right now, we're going to do a little specialty technique right now, like a positional release. So let's say we go and, we can warm things up nice and easy. Just going to give a nice little push to the glute, just kind of say hello. Don't necessarily want to go digging in right away. Might just kick us right back out. And you can just adjust your pressure, just different angles. So we hit all those different muscles. And D, some of these spots, they're going to feel like we're pressing harder than we are,
Okay.
especially when we get onto those little trigger points. It'll almost feel like a piercing ache right where I'm pressing, and you might even get a traveling, radiating ache down the thigh.
Okay.
It might be a familiar pain that you've had at some point
Okay.
after running or sleeping wrong. Sometimes those little trigger
Mm-hmm.
points will activate and they'll give off a referral ache.
Okay.
So now let's say, for instance, we're working that glute area. It's not necessarily letting us through. And it's just keeps kicking back at us. So there's something called positional release that we can do. We get our little, if you want, we get our little tools here. So we're going to just bend that knee out a little bit and just bend this over. That feels okay in the hip there, D?
Yep.
All righty. We can put this sheet back over here because we're going to use our sandbag right on that leg. So if you don't have a sandbag or something, you can always just lean on the client for us to really kind of get into this area. So we're going to go close to the midline as we can, but still on the glute muscles, okay? And we're just gonna push, and we're gonna start out with like the flat part of the forearm, and we're just gonna push straight down. And I know you're tall, Lou, so you might not be able to lean up against the table like me, but I'll usually just lean on the client. D, you're gonna get a nice little, it's gonna let you know that it's not happy we're pushing on it, basically,
Okay.
type of thing. Do you feel that little spasm there? So these trigger points and or muscle will do kind of like this. Our hearts beat like this. These muscles will twitch and they'll spasm, and that's telling us we are right on top of one of those trigger points, and we just kind of hold that. Like Sandra will say, hurry up and wait, or less is more type of thing. And you should be feeling a nice little bit of an ache right where I'm pressing right now.
Yes.
Okay. You getting any kind of referral down the thigh at all?
Yeah, I'm feeling it a little bit in the knee.
Yeah, and you can feel that spasm there.
Yeah.
That's involuntary. It's basically, wow, this one's got a lot to say. You getting any spasm over there right now?
Not really a spasm. It's more just kind of going.
Yeah. Yeah, you can just hold that. If you wanna get a little more specific, you don't have to, but I've already I've brought my arm up, and right now these points in here, they have been sitting in here a very long time. They're not, you know, they're complying, but they're not happy.
Now it's spasm.
Is it?
Yeah.
So that trigger point, it'll spasm. So if this is a muscle or trigger point, and or it spasms and then it loosens. It spasms and then it loosens. So we have a very tight muscle or point. We want it to be loosened all the way. Who knows if that's possible, but any bit of release is a good release. My forearm be in the same general area, and I'm now pushing in a more like 45-degree angle, whereas first I was pushing straight down vertically. Little 45-degree angle here, and I can feel this little spot here is definitely, it needs some work. And these muscles get tight, they all pull in their own direction, and then they cause, maybe those runs that you're doing. I mean, you're fine during the run, but all of our muscles are tight all the time. I don't think any of us really get as much work as we need to. So you were going to have like a cause and effect type of thing. You're going to feel things in joints just from wear and tear. So take a nice long breath now. We're going to go ahead and just apply some more pressure, and all we have to do is just lean in with the body. You can feel that really kind of squawking in there, right, Dee? Yeah. Two, it's a very small pressure to pain ratio. So it feels like I'm just kind of slamming in there. Right now, we don't have to push too hard when we're on the right spot. So it can be a little unnerving. Candace, get some glute action going here. It can be unnerving, especially with clients that have never had trigger point work done before, because we're pushing in a spot. They're feeling that local pain, and then they're also getting a referral pain close by. So, it can be like, oh my gosh, you're pushing right here, but I'm having pain here. Like, what is going on right now? And that's how trigger points are. So we got some good release going in there. I'm going to go ahead and just straighten her leg now and kind of work more by that, what is that bony landmark? That ischial tuberosity.
Yes.
Right where the hamstrings meet the glutes. Have you had this type of work done before, like specific trigger point work? So with trigger points, we all have them. There's over 600 of them in our bodies. If you have muscle, you have trigger points. You know, some muscles like the deltoid, this has 8 trigger points along it. And most of our life, they're latent. They're just kind of sitting there waiting for, you know, a bad night of sleep, a long day at work, an injury, you know, car accident, anything really. And they'll become active. So when we have an active trigger point, that's what you just felt right now. When I was palpating, pressing, it became awake. It started referring its pain. That applies for the rest of the body. So say you sleep wrong one night with your head turned and you wake up that morning and you're just like, you can't even turn your head because it's just a gripping ache coming up the back of the neck. That's a hallmark active trigger point sign. So with these points now, they can be active for a day, few hours, weeks, months, and then they just kind of seem to go away. And it's like, okay, you know, I can move now, I'm back. So they only really respond to direct, intentional pressure. We start to push on them, we're actually activating them, we're letting them allow us to smush them down. It's just like smushing down hard Play-Doh. And that's why we want to stay right around like a hurt so good type of sensation. So we're going to go in the top of the hamstring. Yeah. And there's usually one that sits right in here, and it's just like almost like a ping pong ball size. And most of the time when you're right on it, it will kick right back at you, kind of like that spasm. You know, I don't know if we're able to get a trigger point to fully release. I don't know if that's possible, but a little bit of a release, like I said earlier, is great. So we start to get these trigger points to activate and then deactivate. And everything kind of complies. Sometimes it doesn't, but when it does, what happens is the joint that's closest to the trigger points that we're able to release gets its full range of motion back immediately. It's a immediate result type of thing. Just going to kind of venture right back up into this glute here. You felt that little, yeah, we're going to sit right there. And a lot of people, you know, they might not prefer this type of work because it's a little intense. So, you know, you kind of just judge based on the client's, you know, body, what their body's telling you, what they're actively telling you. And if you need to adjust, you know, to maybe just some nice deep myofascial work, we can always just kind of switch things up. I'm pretty sure Dee's okay with that trigger point type of work, though, especially with how much she runs. She's always moving. So with IT band, you got to be, you know, depends on the client. IT band is extremely tight on everybody, does not get worked enough. So maybe start off with some more broad tools, some palm work. And all you really have to do is just lean in. You should be getting a nice little bit of an ache right now, Dee. Tolerable though, correct?
Correct.
Okay. And, you know, like Sandra will say too, see where the tissues move, you know, sometimes body just doesn't, it just says no. You don't want to force it, but you kind of want to manipulate it to where it says, oh, all right. And then it says, oh, okay, fine. And then it just kind of goes. It's just like smushing down hard Play-Doh. You get people that come in and they're complaining of radiating, crampy type of pain. Not 100% of the time it's an active trigger point, but you do want to check the area, see how the body responds. And, you know, with radiating pain and you're going to start to do trigger point work where they actively feel the pain, it's not necessarily that's where you're going to work. It's going to be somewhere kind of close by, you know. And even though the area they're actively feeling pain, say she's getting crampy, she's getting somewhat of sciatic pain down the leg, okay? this area definitely needs to be worked because it's tight. All our muscles are tight, but to assess that sciatic type of pain, we want to check right into this area, this piriformis muscle. That trigger point specifically will mimic sciatic pain. And like I said before, it applies for the rest of the body. Trigger points will start to get debilitating and they'll start to mimic other conditions as symptoms over time. Got that little click there?
Mm-hmm.
Nice. Got stuff moving. I'm just doing a little bit of some ankle traction right now, kind of working our. All right, so the left knee now, we're going to kind of, there's a little spot right in here, this lateral hamstring muscle. And we're not going to push directly on it, but kind of go right to the side and just kind of be snug up next to it to the side, maybe peel it lateral here, maybe medial, whatever the body kind of responds well to. And we should get a nice deep ache, a familiar ache in that knee there, D.
Okay.
Right about there, we getting something?
Mm-hmm.
Yeah, we can. Sometimes you'll slip right off them. That's okay. Just kind of move back over to where you just slipped off. And right there, we just felt, sometimes you won't, the muscle, the trigger point won't spasm, but you'll feel just a deep vibration. It's just kind of like the whole muscle going, and then it stops. And then you just hold that as long as it's okay for them, pressure-wise, intensity-wise. We just hold that and we let it allow us to smush it down. There's a specific point that's in that gastroc muscle right here that when we press on this, it's going to be a burning ache, kind of, it's going to radiate down. It really could, any trigger point could radiate in whatever direction it decides to. So you don't want to get hung up on, oh, I don't feel the twitch, or they don't feel the referral pain. You don't want to get hung up on that. If you just kind of do some nice palpations, let their body talk to you. And it really just kind of takes repetition, working on a bunch of bodies to get really comfortable with knowing where those specific spots are and how to get them to kind of communicate. So D, take a nice breath now. I've got my elbow right on this spot, and we're just going to go a little more. Is that giving off a little bit of a burny ache? Yeah, and I'm not pushing as hard as it feels here. You'll get little body cues where they twitch, maybe, depending on how the twitch is, how they're breathing, you might want to back off a little. He seems to be fine, and this guy right here, he's been living in there for maybe a decade. Called over some friends for a block party. So if you wanted to work these points on your own, I would get maybe lacrosse ball, maybe even a softball, and you'd have to sit on the ground with your legs flat and really kind of maneuver your body weight to where you find this spot, and it will make you, it'll make you jump. It'll be like, whoa, wow. One more thing too. We talked about the joints get their full movement back when we're able to get these to activate and then deactivate. There's 3 hallmark signs that we're on a trigger point for anyone that's ever doing trigger point work. The first one is the jump sign. So we're pressing on a trigger point and the client literally will jump. It's characterized by exquisite tenderness. It's different than just a tender spot of the muscle. It's exquisite, and it's it hurts type of thing. Hurts so good. The second sign is the local twitch response. That's what we explained earlier, the spasming. The trigger point will spasm. That's basically it letting you know we're right on top of it. It's talking smack a little bit maybe. And you just kind of hold that spot, you know, to their comfort level. And then the third sign is the referral pain. So it's actually called referral pain, but we all perceive pain differently. So some people, they might, you know, be like, oh my gosh, I just don't like this at all. So, you know, maybe you move on, switch up the type of treatment and whatnot. Some people like that, or they know that it's, you know, it's helping what's going on, so they can endure it depending on the pressure level. So like I said before too, you don't want to get too hung up on, oh my gosh, you know, I didn't get a jump sign, or I didn't feel the twitch, or I didn't feel the referral pain pattern. It just comes with doing this work more and more to where you get more comfortable knowing when you're on a spot like that, because we all roll over these trigger points when we're doing just basic body work and whatnot. It's just when we're getting very specific and we want to work those points, those are those 3 hallmark signs that we'll know that we're on one. Your ankles have some serious traction ability too.
I noticed that too.
Yeah. So we're just going to continue to work down this calf muscle now. Getting near to that Achilles tendon too. And like I said before, those 4 hamstring muscles, they're all pulling in their own, you know, this is pulling this way, this is pulling up. Same thing with the quad on the other side. They're pulling up, and they're pulling from that ASIS area, that hip area. So, you know, we'll get stress on the knee. These muscles are pulling this way as well as pulling this way. So we're just going to continue this palpation down to the top of the heel area. And yeah, for time's sake, let's just release nice and slow. We'll get D to do some, just get up nice and slow, D, take your time. Feeling
Good, a lot better.
Yeah?
Yeah, I like it.
Let's do 1 knee bend. Yeah.
So just
Yeah, that same thing that we did before.
oh, I'm sorry. It's
Yeah.
like 1 knee bend.
Yeah, you went
I
right
spend
into
too much
that.
time in the gym.
Nice. Let's do 1 more so Lucas can see too. Nice.
More
Nice.
even.
Yeah.
Yeah, actually a lot.
Yeah.
Good.
This tibialis anterior, this is always tight as well. But like I said, these 4 muscles, the quad muscles originate. It's called the anterior superior iliac spine. It's that bony landmark right here. They all 4 of them come over. They all turn to a tendon right here. They wrap over the knee, and they all insert or attach right here on this part of the knee. So, forgot what that part's called. They all answering. Look at that. So they pull. So we can start off with just some nice, easy myofascial release techniques. Just give some nice pressure. I do remember that term too. Yeah.
Only because they gave us the cheap.
Just get things warmed up here. It does. So just some things too about body mechanics. Sometimes the temperature is a factor. You know, maybe your air conditioning isn't pumping, or when you're putting your hands on a client, their body heat mixed with your body heat will cause you to be warm, hot. You might sweat a little bit, but we shouldn't just be sweating the whole time. Good, Lucas. We shouldn't be sweating the whole time. You want to, it should be almost minimal effort. We're using what Sandra calls the bone stacking. We've got our shoulders up. We are on top of where our pressure is. We're not like hunched over. We're not, our wrists are nice and loose. They're not over flexed. Joints are not over flexed. And then a big one too is a massage therapist after a full shift, maybe they've got, you know, their neck is sore and whatnot because it's so easy to look down the entire time at what you're doing. When you start to work on bodies and whatnot, you know, you're in certain areas of the body, you already have a basic idea of what you're going to do. You don't have to look at your palpation the entire time. So you want to keep your head up. Sometimes you don't even have to look. Sometimes you can even close your eyes a little bit, but you want to be careful with certain areas of the body. If you're working pelvic area, adductors, or chest muscles, or areas of endangerment zones, you don't necessarily want to just look away and then, you know, push in an area that you wouldn't normally push in. We're not going to push directly on it, but kind of right next to it. So the muscle groups are like separated by like almost like septums. And you kind of get into those septums and it doesn't take much pressure, and you can just kind of see something simple like that, like a little hold like that, will get things moving and whatnot. But if we're gonna, I kind of want to work on a specific point in this bottom of this quad, because this trigger point in here will cause just a general ache in the knee. Might be a familiar ache for you, D.
Mm-hmm.
But I'm just going to kind of press down and just almost like, you know, Candace said earlier, like playing the harp. And my pressure is down and almost like a traction-y. You really could go in any direction, whatever her body responds to. Right now I'm pushing straight down, and she's definitely going to be feeling that ache. Might even travel down a little bit into the knee. So one more thing with trigger point work, it's going to go through waves. So we said earlier it's very small pressure to pain ratio. So when we start pushing on a trigger point and it's spasm, it's active, they're like, oh my gosh, wow, that hurts so good. So we're sitting on that spot, and then eventually it'll be 1 second to the next where it just lets you sink in, and you're pushing even a little more than you were at first, and it doesn't hurt at all now for them. So let's say that just happened there, okay, D?
Mm-hmm.
So we're pushing a little more now. It just sank in. You're like, okay, wow, that feels great now. And then I slowly switch up the angle of my pressure of the tool I'm using. We're basically smushing these points out by sections, and then they also have layers. So it'll start out very intense with lighter pressure, and then as you go, it'll start to dissipate. And then when you move slightly, it's like it jumps, it jumps back up to, oh my gosh, wow, that's intense again. That's because we're getting them out by sections, and then sometimes it'll let you into a deeper layer, and then it jumps back up to being intense. That's when you wait, let that muscle just kind of let you through to their comfortability. And, you know, it goes through waves, the trigger point work.